Tim Radford here on WKRK Radio in Murphy, 105.5 FM, 1320 AM, cable TV channel 25, and worldwide, WKRK.love. And today we have an exciting guest. We shared a press release yesterday on our WKRK Facebook page, and I know a lot of people had a lot of great positive reactions from it. Well, the press release, it was Erlanger Heart and Lung Institute. Dr. Harish Manyam was the first person in the country to perform a surgery to implant a unique dual-chamber implantable cardioverter defibrillator. Yeah, that's easy for me to say, right? It's called an ICD. And not only did he do that, but on the same day, he was the first in the country to implant a single-chamber ICD. And we now bring Dr. Manyam on with us. Now, what exactly does this mean in everyday non-doctor terms?
Well, Tim, thanks so much for having me first off. But in really non-doctors terms, these devices, this defibrillator or ICD, it's really meant to take care of patients who have primarily a high chance of dying. And so if you imagine shows that a lot of people watch, ER shows, and patients or people or actors who are, found down and EMS comes to the scene, and then they shock these people with a defibrillator. And so these devices that we're implanting in people's bodies are actually meant for people who are at the highest risk of dying. And we can detect that in a large majority of people based on their heart function. And so what we've done is implanted these devices in patients. And the real unique thing about what we've done is this device is extraordinarily new and innovative in the sense that there are a lot of people that go from Murphy to Illinois or New York or to Florida or to Chattanooga. And the problem with that is that this device can deliver therapy, but in a lot of these patients, they can be found down and a defibrillator saves them. And the problem is nobody is aware of what happened to them. The patient won't be aware, the EMS crew won't be aware, and then it will take a while for them to come to the hospital, for people to figure out that they have this device underneath their skin, what actual brand of this device is, to get the appropriate people there to check that device. And so it delays a large amount of time that we could actually figure out what's going on with them. So the unique thing with this device is when something happens to a patient, that information is actually transmitted immediately and through their cell phone to us. And so we get immediate information as to what's going on with them. And as we say in the heart industry, really time is muscle. And so getting to figure out what the problem is very quickly helps us take care of people in a much more expeditious manner.
Wow. So let me get this right. So the old way of doing things with the paramedic would come to the person's residence, find them probably laying on the floor, do the paddles, and then shock them and getting them, I call it, jump started back to consciousness. And you're actually taking that whole process and putting it inside someone's heart.
That's right. So this process that we're talking about is actually not new in the sense that we're putting this device into someone's body. The process that's really new and innovative is that not only are we putting this device in someone's body, it doesn't matter where that patient is. That, usually patients have to be sent home with a transmitter. Actually, for most people, it's sent at their nightstand. So that's patients who have pacemakers or defibrillators. They have a box that sits there. For most people, has a light that goes on every once in a while, especially at night, and it basically checks their device. Now, the problem is if they travel, if they go somewhere and that box isn't with them, that means they can't transmit any of their information until they go back closer to that box. So the advantage of this is all of us keep our cell phones on us. And so the cell phone is the transmitter. So the great thing is if something happens, no matter where the patient is, that actually the information gets transmitted immediately.
So how does this unit know when to respond?
So that's actually a great question. This unit actually always is looking based on algorithms, mathematical algorithms, to actually detect and evaluate an abnormal heart rhythm. And if the device sees an abnormal heart rhythm and it meets all of these mathematical algorithms, that it will then actually first try to speed up the heart to actually get people out of the rhythm without delivering a shock. And then if it needs to, it would deliver a shock to resuscitate or bring someone back to life.
Wow. This is amazing to me. I mean, I don't have a huge medical mind, but just knowing that this technology is existing, and just to confuse or to clarify things, most people only know the word algorithm when it comes to Facebook feeds. So this is a good kind of algorithm.
It's a good kind of algorithm.
Well, tell us about your role at Erlanger and how long have you been there?
So, Tim, I've been here for about 5.5 years. I am the chief of the cardiovascular space here. So, co-director of the Erlanger Heart and Lung Institute. We have 50 cardiovascular providers. We have a gigantic hospital here, obviously, and take care of every bit of cardiology that you would see in any huge major city. And really, the goal of what we're trying to do and what we try to do since I've been here is deliver care closer to home. And so when I see a lot of patients that actually end up in Chattanooga and then they need health care, they're traveling to Chattanooga to see me. And for years, I've been talking to them about how we would come out to Murphy. And I know a lot of them couldn't believe that we actually did it and came out there. And I think that's what our total mission is.
Well, tell us what drew you to the field of cardiology.
Well, it's interesting because I think initially I was really close to becoming a surgeon in a lot of ways. And what drew me to cardiology is that it is pretty as close to being a surgeon with using some of the tools and devices we use, but also using medical knowledge, which we think about controlling blood pressure, controlling diabetes, watching people's cholesterol, so we can prevent these diseases that we're also treating with a potential procedure. And so I like the fact that I could do all spectrums of someone's care and hopefully try to prevent them from getting to a point where they were on a table with me. And so I just loved being part of the whole process with patients.
And you're right. For years and years, people either here in Cherokee County had to drive to Chattanooga, Atlanta. We're 2 hours from the nearest big city, so we're kind of our own little world here. So knowing that we have now a cardiologist, real living cardiologist here in Cherokee County, that's huge for our little neck of the woods. So tell us about your experience here in Murphy. You opened up a clinic on September 11th, correct?
That's right. So actually, September 11th was the same day that we implanted the first in the country defibrillator that you had mentioned in the beginning. And after I did that, I drove to Murphy. And so that journey actually started with a couple of phone conversations with Dr. Brian Mitchell, just about what the need was in the cardiovascular arena in Murphy. And on my follow-up visit to actually Murphy, which I had done twice prior to me coming up there, I realized very quickly that what he was asking for was help. And he said, we need cardiovascular care in this region. And we know that going to Chattanooga is too long. And so I said, okay, we'll come there. And so he was really, I think, the driving force for me to push for us to come there. And, I went to clinic there on September 11th, have loved every single patient that I've met that day. I mean, I could tell that a lot of people were not only from Murphy, but transplants from all over the country, and just fell in love with what that area has to offer. And so I think I was excited, they were excited, and it was just a great experience. And we're just looking forward to continuing to do that.
Fantastic. Well, tell us, let's see, the device AFib, is that the same device or is that a completely different
So,
situation?
so AFib is actually an abnormal heart rhythm. And
Okay.
so AFib is actually the most common abnormal heart rhythm in any patient or person. About 20% of us at some point in our life are going to develop that abnormal heart rhythm. For some people, they can occasionally feel their heart racing or fluttering. Sometimes you can feel short of breath that goes away. And some people, they just feel fatigued and they're not sure why. They just feel like they're getting older. I'm just tired. And in actuality, they're in this abnormal heart rhythm. And so we know that that abnormal heart rhythm actually leads to a higher chance of having a stroke if undetected and untreated. And in some patients can lead to a weakening of the heart muscle as well, which could lead to actually the need for implanting these devices. And so when we see those abnormal heart rhythms, what we try to do is take care of them. And if we can, in some cases, eliminate that abnormal heart rhythm, we see a clear restoration of the heart function back to normal. Then we can eliminate the need for these ICDs or defibrillators. We don't have to implant them.
Is there a certain population that is more affected by AFib, and what kind of symptoms would a person have to even go seek treatment?
Sure. So actually, unfortunately, it's a wear and tear abnormal rhythm is the best way to put it. And so as we all get older, we have a higher probability of developing this. And so, I like to tell people, our bodies are actually not that dissimilar from automobiles in a lot of ways. We have to do preventative maintenance on them. So my expectation for our patients is to always make sure that, let's check you, let's make sure things are good. Let's control your blood pressure. Let's control your cholesterol. Let's see how you're feeling. But then at some point, problems develop in cars. We expect them at 60,000 miles, 70,000 miles, very similar to the body, that's when we start expecting atrial fibrillation. And the symptoms that you could potentially feel from that are sensations like your heart is beating very fast, or what we call palpitations, sensations that you feel short of breath. All of a sudden, you could just be sitting and you're not doing anything exertional in nature, and you just feel spontaneous shortness of breath, or people just feeling fatigued. There's actually a lot of people just feel run down. And I equate that to, they're used to having a V6 motor in their body ready to go. And all of a sudden, they just feel like kind of run on a V4, and I'm okay with that. And they feel like they're just getting older. And we see a lot of patients in their 60s, 70s, and 80s that start feeling that way. And in reality, they're just in this abnormal heart rhythm. And if we correct it, we actually eliminate that problem completely.
Oh, wow. So I'm guessing the standard patient who is suspecting they have symptoms, they don't actually contact your office directly. They're referred by their general practitioner,
That's right.
primary care doctor.
A large majority of people, they feel something abnormal. And in some cases, people do come and see us directly. We see a lot of patients who have seen, in some cases, other heart doctors or specialists and decide to come and see us for another opinion to figure out what's going on with them. But a large majority of our patients come from good primary care doctors who are doing preventative maintenance, and they say, did you say that you feel your heart palpitating every once in a while or beating fast, or you feel shortness of breath? And they put on a heart monitor, and then they find out, hey, you actually have AFib. And they find this abnormal rhythm, and then they send them over and say, hey, you got to go see this heart specialist. And then we start working on eliminating that and protecting them against having a stroke.
Well, fantastic. Well, I have learned a lot during this interview already. I told you before, I'm not very medically minded, and you have given me so much information and so much wow factor that this is even a possibility nowadays. Is there anything that we need to talk about that I haven't asked about yet?
No, Tim, I just want to tell you, I am just so happy to be in that office with the primary care doctors there, serving the people of the region. I want to keep people at home. I don't want them to drive far. I find it easier for people to have their family in the room with us when we talk about healthcare.
Mm-hmm.
And it's really hard to do that in Chattanooga. And coming to a big hospital, not knowing where you're going, parking in a deck, and trying to figure out which way is up. We get that, and we want to come there, and we're committed to staying in that region. So we're just really happy and proud to be part of that area.
And where is your office here in Murphy? Is it with Dr. I forgot his
Dr.
name.
Mitchell.
Dr.
Yeah,
Mitchell. Yes, everybody knows Dr. Brian Mitchell, and for some reason my mind went blank trying to think about it.
yeah, we're right in that office with him. We'll be there on Fridays, and then just depending upon, what the need is, we would expand our services as needed.
Well, this is fantastic and exciting. We're excited to have cardiology here in Murphy, North Carolina, which is going to be really attracting folks from the region to come seek cardiology care here in Murphy, North Carolina. So it's a pleasure to have you here, and I'm so excited to be able to share that press release and know that we have quality here in our hometown.
Thank you so much, Tim. I appreciate the time.
Thank you so much. We'll be talking with you soon. Have a great week.
You too.
Bye-bye.
Bye.